With that, we're going to open it up for public comment on this item alone, because again, we'll have public comment throughout the course of today's hearing.
Turn around here. Madam Chair, members, Kobe Pizzaia with the California Association of Psychiatric Technicians. You mentioned the time frames. That is very important to us. We feel that the 2018 goal, while laudable, is just, it's an unrealistic goal. Putting a realistic goal in place seems to be the better approach. So you don't have this sense of being rushed into something and developing. It's incredibly important to develop community supports and resources before you start setting goals in place. So we ask that you amend the language from 2018 and 2021 out of the proposed trailer bill language and the October 1st deadline. Move the October 1st deadline to April 1st. Make sure that we have time to get the structures in place. We were absolutely blindsided by the May revise. We had no heads up, no warning that this was even going to transpire. In fact, I found out from an email that went out by Marty Emoto. So we virtually had little to no warning. Secondly, we cannot emphasize enough how important it is to have a community state staffing program in place. The Lanham enclosure had virtually no participation from direct level of care. There were very little providers that even offered or even participated in the program. It's crucial to us. We had members that have worked with these clients for 30+ years. They became effectively family to them. It's important to continue that care into the community, to have that family bond almost as they go off into other community placements. So with that, thank you.
Thank you very much, and I'm going to ask each witness to make sure that your comments are focused on this agenda item. Thank you. Next witness.
Good morning, Chairman Mitchell and members of the committee. My name is Jim Burton. I'm Executive Director, Regional Center of the East Bay. Serving over 18,500 individuals with developmental disabilities in the East Bay. I want to start by acknowledging and applauding the administration for this proposal for the closure of these developmental centers. I want to also acknowledge how important it is and how for us to hear from all of the committee members today in terms of the strong interest in making sure that every individual is afforded a great life in the community with proper services. And I want to make a commitment from those of us at the regional centers who will be involved that we will work collaboratively. We look forward to working collaboratively with the administration, with the legislature, most importantly with residents and families to make this an outstanding transition for every individual. Thank you.
Thank you very much. Next witness, please, 2 minutes.
Thank you, Madam Chairwoman and committee members. My name is Bob Hamilton. I'm the director at North Bay Regional Center. We serve over 8,000 clients in the 3-county area of Solano, Napa, and Sonoma counties. I'm here to say that we've been working with the coalition. We've been joining them in their meetings and talking about the issues and understanding what their needs are. And so we're not ahead of the game, but we're really in there pitching in terms of what we need to do to serve this community, this special community. I might mention that our former board president at North Bay Regional Center is also a family member at SDC and a member of the PHA Coalition. And we're working with that group too. We're meeting with them next week or a week after next to start those discussions. We're meeting with my peers, the other directors. We have folks in there the following day. We're meeting with the department a couple of days from now. And so we're trying to really get a jump start on this because we know it's a very tight timeline. I just wanted to mention relative to the staff, state staff, there will be an opportunity fair at SDC next week, and we're going to have a booth there, and we're going to be talking about employment opportunities and trying to work a clearinghouse to see what we can do to make that work. Thank you.
Thank you very much. Next witness.
Madam Chair and members, Dwight Hanson on behalf of the Alliance, as well as Easter Seal Superior California and STEP Agency. A couple of things. One, most of my members are serving people who have transferred out of developmental centers in the past. Almost all of them are serving people who, without the waiver, would in fact be in the developmental centers. The community has a great deal of experience on dealing with people who have very severe needs. I applaud everything you've said about doing this right and making sure it's an individually program planned process, that the needs are identified and met. But we've been doing this for 45 years now, and the DCs are slowly closing, but they're very slowly closing. The one thing I guess I would put on the committee's agenda for the imperative of this issue, notwithstanding moving forward diligently and correctly, you're backfilling $40 million a year in the developmental centers. The reason that Sonoma lost its credentials isn't because the federal government just prefers something else. Yes, they do, because the statute does. They're being denied their federal money because of a long list of abuses and neglect. And every moment that we delay is another moment that we're putting $1.4 million a month into those. So we have some imperative to move forward. We urge that we do that. We ask you to bring forward the providers who are doing this work every day on how to serve these folks and get assessments done by people that are knowledgeable. Mm-hmm. Last thing I'll say is that the Supreme Court found this to be a problem in 1981 in rehab. And they said that they didn't trust developmental centers, regional centers, families and all that to protect the civil rights of the folks. They wanted an independent process. That I evaluated these folks based on their individual needs, and they didn't have a axe to grind or a conflict of interest. We need to go forward with that, and that assessment needs to be done by people who can really assess these folks independently. With that in mind, thank you very much. We applaud the governor's proposal. We thank this committee for its attention.
Thank you. Next witness.
Hello, my name is Jackie Dillard-Foss. I'm with the California Supported Living Network. I really wanted to see, when I've listened to the developmental center families and the folks that are currently in the developmental center, and that really is my target, is what is going on in the developmental center. So I looked at the federal plan of correction, and these are just my highlight points for me to say, are we looking at the health and safety of those individuals currently in the developmental center? It was facility staffing, staff training, staff assessment, active treatment, which for me, active treatment is all about the individual receiving goals and objectives so they can have the fullest life possible. Client protection, and I just really want to read this before we go. When I look at that date of 2018 and I hear health and safety, I think, are we looking at the individuals at the developmental centers when the federal government says under client protection, the facility has failed to provide a safe environment for the clients residing in Sonoma, resulting in numerous serious client injuries. The facility is responsible to organize itself in such a manner that it proactively assures that individuals are free from serious and immediate threat to their physical and psychological health and safety. That is the focus. That's from the federal government. That is part of the program. This has not been a new conversation. Every year we hear about the decertified units. 4 are sitting there. They're moving people from one unit to the next, I heard yesterday. I heard for years in and years out about transfer trauma. So I just really want to say really quickly, you're moving a person from one unit to the next. What's the difference between moving them from one unit to the community? I didn't understand that conversation. If you want transfer trauma, put them where they will be for the long term. So let's remember what the federal government has said. It's not because they don't like the model. Client safety. Thank you.
Thank you. Next witness, please. 2 minutes.
Madam Chair, Senator Monning, Senator Stone, my name is Terry Rohde. I'm from Paradigm Adult Day Services, but I'm here more on a personal testimony. In 2007, I asked licensing if I could go and visit one of the homes where several clients were moved out of Ag News. I was fortunate enough to go and visit a home which was state-of-the-art, and a young woman, well, actually, a young woman, she was 54 years old, has spent her entire life in Ag News. She was brought out by her Hoyer lift from her bedroom into the living room. I got to sit there and hold her hand with her staff, who was the same staff who had been with her at Ag News. And the amazing thing about this young woman, the only way that she could communicate with me was by blinking. And the staff knew when she blinked, when she was happy, when her needs were being met, and when she was uncomfortable. Seeing this young woman in the state-of-the-art room, in the state-of-the-art home, in a better life, with only 2 other residents there, I applaud what the administration has done. I saw it firsthand because I asked to see it firsthand. So I thank you for following through on this. And I want to share with you, it was a very humbling experience to see this young woman thrive, who couldn't speak, who was around her own staff, and could smile with her eyes. Thank you.
Thank you very much. Appreciate that. Next witness, please. 2 minutes.
Hi, I'm Paul Bilodeau. I'm Executive Director of Valley Mountain Regional Center in Stockton. We serve about 12,000 consumers, about a mid-sized regional center. And we've been placing people into the community from developmental centers for a little over 40 years now. And we've gotten pretty good at it. So we know how to do it, and we're very pleased that the governor put that in his proposal to actually close the remaining 3 developmental centers. We're not as concerned about the dates. We know that they're going to float. But it's just important that they made that goal, and and we're going to help make that happen. What I do want the group to consider is that the Lanterman Coalition did recommend doing things to try to shore up the community services section, both regional centers and vendors. The vendor community will have a difficult time accommodating the needs of everybody coming out of DCs if they can't get a decent rate. And regional centers have a hard time of keeping staff when we can't pay a competitive wage. So thank you for listening, and good luck.
Thank you. Appreciate it. Next witness, please. 2 minutes.
I'm Dina Feifel. I am a consumer and board member for Valley Mountain Regional Center in Stockton. I am very happy that the government budget issues a goal for closing 3 developmental centers. We still need money for community service and provides can meet the needs for consumers. Leaving the developmental centers, the regional center cannot prove the right service and support for consumers. Watch out fundings. The Lanterman Coalition's budget will allow the community to needs for people living the detrimental service, and as will help to serve the over 280,000 person with detrimental disabilities and their families' concerns living in community. Thank you for listening.
Thank you very much. Appreciate it. Next witness, please. Try to top that.
I can't. Ditto. Rick Rollins here on behalf of ARCA, Association of Regional Center Agencies, and Senator Monning, Senator Stone, distinguished staff, and of course Chairwoman Mitchell. ARCA, Association of Regional Center Agencies, has had a longstanding policy of supporting the closure of developmental centers. We feel confident it will be done right. This is a very historic time. I don't think I can not say that as we move from a system, a bifurcated system, quite frankly, to a system for all. And I think it's important to note that for every person in a developmental center right now, we have thousands of other folks in the community with similar needs. And hopefully from this point forward, we can start raising the bottom. And unfortunately, the bottom of the system has been the community for too many years. And it's important to invest in the future, and the future is in the community. Thank you.
Thank you. Next witness, 2 minutes.
Good morning, members of the committee and staff. My name is Nancy Lee. I am the parent of a 31-year-old son with autism and mental retardation. There is no question that my son would be a resident of a DC were it not for the Lanterman Act, were it not for the community services that have been available to him, for which I am eternally grateful, as is he. He has a job with the Davis Enterprise. He delivers the Davis Enterprise 5 days a week. He walks 4 hours a day, covers 4 routes. And he knows he is part of the communication system and the news system of the state of California. But what concerns me, and I am totally in favor of closing the DCs, because I think these individuals will similarly have a better experience in the community than they have in the DCs. But I have witnessed the continuing falling apart of the community services system. Now, I appreciate the deadline to close the centers, but I recognize that there has to be a viable and healthy community services system for these individuals to be brought out to. So I'm just asking you to consider the 10% increase for the Lanterman Act for our regional center, our community system, because it is a necessary and critical part of what you are discussing here today.
Thank you very much. Next witness, please, 2 minutes.
Marty Yamoto, California Disability Senior Community Action Network. I'm a family member. My older sister had developmental disabilities, lived in Monterey with my parents many years ago. But for a quirk of fate, she would have been in a developmental center. My parents just sent me to Agnews back in the early 70s to check it out to see if that was the right place for her. And I came back and decided it wasn't, but it had nothing to do with philosophy back then. It had everything to do with it was too far away and it just didn't seem right. And I would miss her, and we would all miss her. So she didn't go there. But for that quirk of fate, she would have been there. And my parents would be those same parents who fear the future because the state of California is deciding something different. What we say here matters, and I appreciate the words of the committee and the department, and also the words yesterday in the subcommittee. But more importantly, it's what we do. And no matter what assurances we give to the families and to the workers, it doesn't take away the fear of the future that they face. And so it really matters that all of us in this room, the legislature, the administration, stakeholders, respect that fear of the future, and then we all work together for something that's just and real, and that is good for all of us. Because guess what? Everyone else in our system is going to have to transition because of the major changes occurring in home and community-based regulations, workforce. We're all going to have to change, and that fear that those families and workers feel in the DCs is going to be reflected in the fears that workers and consumers feel in these other programs they have to change too. And so I applaud the administration for making a decision. That was good. But now we all have to now, like you said, be real in what we do. Thank you.
Thank you very much. Next witness, please, 2 minutes.
Alicia Serpico. I am a parent of a consumer receiving regional center services and also an employee of Valley Mountain Regional Center. And as a parent and an employee of a regional center, I'm very pleased that the governor's budget includes a plan to close the remaining 3 developmental centers. And without proper funding of community services, providers cannot adequately meet the needs of developmental center residences, and regional centers cannot effectively coordinate services. The Lanterman Coalition's request will allow the community to meet the needs of developmental centers, people leaving developmental centers, and also help to serve the over 280,000 people with disabilities and their families who currently reside in the community. Thank you.
Thank you. Before you begin, let me ask, because I had kind of visualized, I saw my friend here in the red shirt, and then people have added on. Is there anyone else who intends to queue up for public comment on this item? Okay, thank you. So, ma'am, you'll be the last word. Go ahead, 2 minutes, please.
Good morning, Madam Chair and committee. Thank you so much for taking these issues so seriously. My name is Joan Schmidt. I have a son who in 1990, I still have the letter from Sonoma saying his behavior was too aberrant to be in the community, but they suggested perhaps Agnews. He moved into a supported living agency and has been they're very successful. And all of these years, we tried to replicate what worked for him. So I now have an agency in Sacramento, a supported living agency. We see this all the time, and I just want you to know that the emphasis on health is so important. We have that, we're doing it. However, for the first year, this year, I will be in a deficit in my agency, and I have these figures that I don't like to talk about, but say that in 3 or 4 years, I'll have to close my agency without assistance. So thank you for looking at that. Very, very much I support the Lanterman Coalition and everything it stands for.
Thank you. Next witness, please, 2 minutes.
Madam Chair and members, Carl London here on behalf of the California Disability Services Association. We're an organization of approximately 100 community-based agencies throughout California that serve this population. I want to express our support for the governor's May revise relative to the developmental centers, kind of in line with Senator Stone's thinking. We obviously know this is going to be a process, but we want to urge you to look very carefully at the resources, what we do with the developmental center resources over time. Every other closure we've had, the resources go away. They evaporate after closure. The community gets nothing. I've also passed out for you a reminder of just the history of the rates in California and what we've done over the last 13 state budgets. This community has not had but one increase over that time period in 2006-07, and that was promptly taken away a couple years later by the legislature and governor because of the falling out of the economy and the state budget overall. Restored in the last couple of years, but only restored to 2006-07 levels. So one rate increase, you basically, the legislature and the governor's office has asked community-based providers to provide the same level of care to 280,000 people at a 3% increase over a 13-year period, while consumer price index alone has risen over 30%. It's impossible to do from a business standpoint. You don't make up negative numbers in volume by doing more, and this budget has to recognize rate increases for this community, and we urge strongly that you include that. We're appreciative of Senator Stone's comments on this. Again, want to applaud him, particularly coming from the Republican wing, at looking at reinvesting and putting money. I'm glad that he's brought himself to the party,
Okay,
quite
we need
frankly.
more just him.
But and the last thing
I love you. I love you, but you're one.
Well, your good friend, Ms. Grove, is on the same page, too. So
Okay, you can wrap up your testimony now, sir. Mr. London, are you done?
the last comment I'd make is I also dip my pool into the volunteer side of things. I'm now, unfortunately, a board president of a local agency in Sacramento. And we're at the point today where we are losing staff because of money. That creates great instability among the people we serve, and in this population, stability is everything. Please include a rate increase in this budget as you move it back along to the governor. Thank you.
Thank you. Next witness.
Morning. My name is Joe Matters. I'm with People First of California. One of the things I do with my job title is do training. So I did a training at polio development centers, and one of the things we talk about is goals. And of the 45 people I trained in there, all their goals were to have a quality life one day in the community of their choosing. So we strongly support of closure of the DC soon. Thank you.
Thank you very much. Next witness, please. 2 minutes.
Hi, my name is Gary Gregerson. I work at the ARC, San Francisco. I've worked there for 17 years. I'm also a member of SEIU, Local 1021. And, reading the proposal, which sounds like a good proposal, seeing how one of the challenges is the difficulty in the recruitment and retention of qualified staff. That's even within the public system, and it's really scary to think how there's, even more difficulty in the current community system. I thought my brothers and sisters in SEIU Local 1000 were sitting pretty working at the developmental centers. I didn't know there was difficulty in retaining and recruiting staff even in, public service. It's really, really frightening to me. And, I always like to look at the bigger picture. My job, like putting the oil companies on the hook for their taxes that they don't pay, versus every other state in the country that pays for oil tax extraction. Ours doesn't. Why is that? That could bring in billions of dollars to our system. And also in the bigger picture, feeling like at this point, as a worker, I know it's kind of taboo to talk about, like I do care about the people I work with. If I'm talking about trying to just live. I don't feel it, I shouldn't be able to talk about that. But, and I live in San Francisco, and I'm able to somehow get by on $16 an hour. But I'm thinking at this point, we need to take action the way that fast food workers have been taking action across the country. People in my position, people doing direct support need to take that kind of action. Thank you.
Thank you very much. Next witness.
Good morning. My name is Stacy Sisson. I work for a supported living agency here in Sacramento. I wanted to thank you, Senator Stone, for your comments earlier this morning. And on your comments, Senator Mitchell, I wanted to say you're right. This is a relay race. Unfortunately for the people in the developmental centers, that race clock started ticking down a while ago. But the good news is the community has been training for this race since 1969. So we're ready. We're ready to take that baton. We just need a little thing called 10%. So thanks.
Excellent.
Good morning, and thank you for hearing me. Thank you for all being here. My name is Audrey Deschadnan. I'm the mother of Valerie, this beautiful young lady here who turned 30 last week. She would certainly be a candidate for development centers in another time. She lives with me. She's interested in moving into the community, into her own home, but there's no place for her to live. I really applaud the governor for the plan to close developmental centers. I applaud Senator Stone very much for your plan to bring that money into the community. I appreciate Senator Moning's concern for keeping the foundation supported, and I just want to state my concern for how that will work for the people coming out of the developmental centers when it isn't working right now for the people already living in the community. The system is crumbling. I know you know that. I know you know things are falling apart. There isn't enough anything for anybody. The gentleman who just spoke about pay for workers is absolutely right. The people who do that kind of work are working 2 and 3 jobs. They are not selfish to ask for more money. They do it because they care. They wouldn't be doing it if they didn't care. And I request, please, that you consider that 10% the Lanterman Coalition is asking for. It will not only support the people coming out of the developmental centers, but actually make it possible for the people already in the community to have a standard of living that we have been hoping and working for years now, and that really isn't there yet. Thank you so much.
Thank you very much. I appreciate it. The recommendation is to adopt the LAO recommendations as supplemental reporting language. I won't read the LAO recommendations. You can see them on page 16 of the agenda. Thank you. That'll go out with a 2-0 recommendation, and we'll allow Senator Monning to add on when he returns. We'll move on now to issue number 2, Community Placement Plan funding.
Good morning, Madam Chair, committee members. I'm Nancy Bargeman, Deputy Director of the Community Services Division at the Department of Developmental Services. So regarding issue 2, this is CPP funding, actually primarily for headquarters position. We are asking for 7 positions that would be supporting the efforts that are outlined and certainly around the discussions that we've had today, but outlined in issue 3. The 7 positions would be able to help facilitate and support the regional centers' efforts in developing the community capacity under the community placement plan, as well as having a housing consultant that would be able to help provide guidance and legal oversight for any of the housing development that be associated with developing the community. The last item was then for an interagency agreement with Department of Social Services to have a position that is directly related to a position that will expedite the licensing of all of the homes that we are looking for development in short order.
Thank you. Any comment? LAO.
Recommend approval.
Finance. Any public comment on issue number 2? Are you coming to? No, she's not. Any public comment?